This video demonstrates how to use the DEVON Supine Lithotomy in Trendelenburg, or SLT, Positioning Kit, as well as the benefits of the kit. Let's begin with a few of the key features and benefits. This kit features a dual foam design. The top white layer of foam molds to the patient's body, while the bottom, blueberry swirl base layer of foam aids in the distribution of pressure. The attached straps firmly secure the foam to the bed rails. The foam graduates from a height of 2 inches at the sacrum to 3.5 inches at the shoulders. Additional support is provided in the shoulder area to aid in proper pressure distribution. The SLT Foam Positioning Kit also features a sheet pass-through system where the sheet passes through the center of the dual foam design rather than on top. This maximizes the patient's contact with the memory foam and the pad's contact with the table. First, place the graduated foam pad on the table as shown. Then attach the black fastener straps to the bed rails by looping the straps under the rail and affixing the end of the straps to each other. You may then unwrap the sheet and add a headrest if desired. Another key benefit of the SLT kit is the perforated perineal pullout, which allows for customization based on the type of procedure and patient's body type. This feature eliminates the need to cut the foam prior to use. Once the patient has been rolled into the room from pre-op on the stretcher, lock the bed and lower the rails. Under their own power, the patient will shift themselves onto the operating room table. Next, place the patient on the graduated foam table pad, placing the sacrum on the lower part of the pad edge. Adjust the patient as necessary using the draw sheet to ensure the patient's shoulders and sacrum are in contact with the pad's surface. The sheet contained in this kit is wider than most and can be used to facilitate complete arm support. Once the patient's arms are tucked, the sheet is then tucked into the side slit of the pad instead of directly under the patient's back. This reduces the risk of the sheet putting pressure on the patient if not tucked completely flat. To properly attach the body strap, place the blue foam over the patient's chest with the convoluted side facing away from the patient. To apply the patient positioning straps on each side of the bed, start by holding the buckle of the strap with the blue side facing you. Feed the strap through the bed rail and then pull the bottom white strap up through the buckle. Once through the buckle, tighten the strap against the bed rail. The blue side of the strap is now facing the patient. The strap is secured and placed over the blue foam. Bring the hook part of the second strap over the patient and the chest foam to secure closure. Once secured to the pad, you can place the patient in the Trendelenburg position. For additional information, visit cardinalhealth.com or contact your sales representative.